this virus is not a blue state virus, and it's not a red state virus. The deadly nature of this virus is not a hoax. Choosing to go out in public without a mask is not a political statement. It demonstrates a callous disregard for the people in your community and in your county and in our state and our nation.
There you have it. Illinois officials are sounding the alarm for a second week in a row. COVID-19 cases are rising again across the state, with IDPH logging its highest number in nearly 2 months on Thursday.
Let's explore. Dr. Emily Landon is the Executive Medical Director for Infection Prevention and Control at the University of Chicago Medicine. She joins us to talk about what's next. Dr. Landon, welcome. We appreciate your time. Several steps were taken back this week, as you know, announced by the mayor. And I'm just sort of curious, how do these steps get determined? For example, we can't have any indoor bar service without food. Why is it only liquor bars aren't okay, but a bar with the food is okay?
So I think there are a lot of things that go into how we make the decisions like this. And it has to do with the proportion of cases or proportion of tests that turn positive, the number of cases that we're seeing, the age ranges of the cases, the hospitalization records. And so things are looking a little bit like they're going in the wrong direction. The reason why there's this sort of splitting hairs about eating and not eating in bars is because places that have tables where you can seat people separate from other people and you can maintain that distance where people have basically assigned seating are somewhat safer than places where people have to gather at bars. And they have definitely have maybe an older clientele, and we are seeing a lot of cases in the 18 to 29 age group, and there's a lot of concern that that's happening at bars, where it's much more difficult to contain the number of people and control the number of people in the bar than it is when you have assigned seating at tables.
That's a very clear explanation. Thank you for that. The coronavirus numbers in Illinois have risen to more than 1,000 cases per day once again. Do we need to shut things down to get back below 1,000 per day?
Well, there's some good evidence now that 90% compliance with wearing masks, having no indoor eating, so that would be a step up from where we are right now, so no indoor restaurants, and then also maintaining social distancing and all of our other activities. We may be able to do that instead of having to go back into a shutdown. There's evidence that that may be just as good. Now, that evidence is based on modeling and isn't exactly been proven yet, but I think it's important that we try all the steps before we go back to being completely in shutdown. And to be honest with you, Illinois is doing better than many other states because we've been so careful and so judicious from the very beginning. Many states have found that the day that they put a mask mandate into effect and people start wearing masks is the day that the numbers start coming down. And we did that way before many other states did. And I think it's been really to our benefit. So as the governor said, I agree 100%. Do not leave your house without a mask. Do not go around other people without a mask.
And as you can see, the modifications, they are trying to be careful. We look at CPS, for example, where juniors and seniors were going to be remote, maybe not now. The risk appears to be these students going home, infecting their parents or their grandparents. Is this just a calculated risk at how it gets occurred, or can steps be taken like social distancing, even at home, increased testing perhaps at schools?
Well, increased testing looks like it's not going to be a great reality for us in the fall. We are seeing extreme shortages in testing reagents, even in states like ours, where we did have a lot more capacity for testing a few weeks ago than we do now, because many of the reagents that these companies are supposed to send to us are being diverted to the other states where they didn't have great testing programs to begin with. So we're still behind the 8 ball on testing. I don't think we can rely on testing to keep us safe, besides the fact that testing doesn't find a case until it exists. And so what we need to do is really prevent the spread of those cases in the first place by wearing masks and social distancing. There are guidelines on the CDC's website about how to maintain social distancing at home, but this is really difficult. I think we're going to have to think very carefully. For some kids, it's not going to be appropriate to go back to school because of the family situation that they live in or because of their own personal health situation. And the Illinois State Board of Education and the CDC both recommend that there be all remote options available for kids who can't attend school because of those reasons.
Dr. Landon, President Trump announced this week that Republicans had scrapped their plans for convention activities in Jacksonville, Florida. The Cubs, Chicago Cubs, presented a proposal for about 8,000 fans at Wrigley Field. Conventions, concerts, sports, can we do them safely without a vaccine?
Not yet. Maybe at some point, once the case counts are so low that it's unlikely that any one of those 8,000 fans has COVID, then it becomes a lot less riskier for us to have those people get together, even in a socially distanced way. But because you can have contact with people, people aren't perfect with their masking, there's no way to really police social distancing, we have to rely on individual behaviors. We really need to stack our interventions. And that means social distancing, masks, cleaning your hands, and testing when you don't feel well, and making sure that you stay home if you've been exposed. And then also having a low case count in the area makes everything safer. And so if we work hard by being really compliant with our masks, our social distancing, staying away if we've been exposed to someone who has COVID, then we can have a lower case count so that everything gets safer.
All right, Dr. Axel, I'll give you 10 seconds for this. How do you get through to a virus denier?
I'm not sure. I think that there are a lot of people who would be happy to tell you about their experience with COVID and how dangerous it is. I could invite them, although we don't really allow very many visitors right now, to come and see what things are like in a hospital where we have COVID patients. But I think that people are in denial, but that's just part of their experience of what they're having to face.
Thank you.
All right, it is real. Thank you, Dr. Emily Landon, for your time. We're going to take a break. Coming up next on WGN-TV Political Report.
I think mail-in voting is going to rig the election. I really do.
Are you suggesting that you might not accept the results of the election?
I have to see.
Sowing doubt on democracy. We're talking about mail-in voting across America ahead of the presidential election.